We have a 22% poverty rate in Savannah, which is 6 points higher than the national average. It's been stagnant for 30 years. And so it was very clear for people like Sister Pat that something different had to be done.
Very few agencies do anything like we do. We reach out. And of course, the reason why we are so close to the community, because when we started in the center, we visited the whole area. So we got a chance then to see them from the very beginning and see what their needs are.
It's very easy when you're dealing with social accountability initiatives to get burnt out because there are so many issues, some you know, some you don't know. But she has stuck to it, and that has allowed her to win the trust of the people in the neighborhoods, and that's why we're starting to see some of the positive outcomes because of her tenure.
Individuals that come to St. Mary's to get their taxes done, generally 85% of them are individuals who've come back year after year. That goes along with Sister Pat because of her leadership skills. You feel that warmth from her. You know that when you come into St. Mary's to get a service, it's not only because you need it, it's because they're able to get it because of individuals like Sister Pat.
We try a lot for preventative health as well, like I said, healthy food, having the kids have insurance so that they can go to the doctor and the dentist and all that kind of stuff. We also help with the senior citizens and making sure that their drug plans with Medicare, that they have the most affordable drug plans that they can have.
The top four chronic diseases we see are diabetes, hypertension, obesity, and high cholesterol. And if there's a patient at the health center being seen that falls into one of those four categories and could greatly benefit from coming over here, we'll go through how they typically eat and how we can make little changes to that progressively. So when they come and meet with me, we sign a 6-month commitment to creating these lifestyle changes to better their whole eating, exercise, just their whole lifestyle.
Well, back in the fall of 2004, Sister Pat Baber approached a group of nursing faculty at Armstrong with a community need. She asked us if we could come down to the community center and perform some screenings. You know, it's funny how you can live in a community and think you know what the needs are, but until you truly get at the grassroots level, like Sister Pat and the community center and the health center are, you really don't.
They really have been instrumental in not only putting forth the call to action that we need to work together as a community to address something like poverty, but they've also rolled up their sleeves and really gotten involved directly with us in offering workforce development services, and in a couple cases even national policy.
She doesn't get any income from this. There's no ulterior motive. It's not because it's part of a career plan where you advance and move on to a higher paying job. It is purely for the sake of trying to do good in a community of people who in many cases don't have an advocate.
And you see, school, colleges, and universities don't give you that. You can get a PhD, all the other Ds, but you don't get that D. That kind of thing of concern and commitment. See, like I said before, you can teach people skill, but you cannot teach commitment. And she has that.
Thank you for recognizing our work. I just want to be clear that this great work that's done is done through many, many hands and many, many hearts. It is truly a partnership that begins with St. Joseph's Candler Health System. We do the work we do because of our many partners. It's all of those people who have made a difference and an impact on people's lives. So I'm just the lucky one, but in the name of all of our partners and all of the good helping hands and hearts. Thank you.